I will now answer questions that came through following Tuesday's update session. A recording of today's session will be available shortly on the Maternity Review website. What assurances can you give me that recommendations will be implemented and other families will never go through the heartache that we have? Following publication of the first report, the Chief Executive at the Trust, Louise Barnett, said, "As the Chief Executive now and on behalf of the whole Trust, I want to say how very sorry we are for the pain and distress that has been caused to mothers and their families due to poor maternity care at our Trust. We commit to implementing all of the actions in this report, and I can assure the women and family who use our service that if they raise any concerns about their care, they will be listened to and action will be taken." Nadine Dorries, the Minister, said, "I expect the Trust to act upon the recommendations immediately and for the wider maternity service right across the country to consider important actions they can take to improve safety for mothers, babies and families. This government is utterly committed to patient safety, eradicating avoidable harm and making the NHS the safest place in the world to give birth. We will work closely with NHS England and Improvement, as well as Shrewsbury and Telford Hospital NHS Trust to consider next steps." In the days following the publication of our first report, NHS England wrote to all trusts, asking them to review their maternity services against the immediate and essential actions in our report. Today, NHS England announced very significant funding of £95 million across maternity services in England to improve staffing and training. The funding is linked to the 7 immediate and essential actions outlined in Report 1. This is really positive news. Will there be any prosecutions? Will anyone be held accountable for the mistakes that have been made to all the families? In June last year, West Mercia Police confirmed that they are launching an investigation into the care of mothers and babies who died or suffered serious harm in the maternity services at the Shrewsbury and Telford Hospital NHS Trust. Since the launch of their investigation, we have continued to work closely with West Mercia Police, as well as with NHS England and Improvement and the Department of Health and Social Care, to ensure that families' voices continue to be heard. Families have been contacted and are assisting the police with their ongoing investigation. If a clinician has since moved abroad and was found in breach of professional standards, would this affect any subsequent registration and fitness to practice in another country? Earlier on, I described the GMC and NMC responses and their approach to responding to concerns raised by you. The NNC and the GMC have both given an email address as a direct point of contact for families. My team here will include in our email to you the email addresses you can use if you wish to contact the NMC and GMC yourselves. What staff training is now in place for non-blood treatments? Can someone tell me from my notes what surgery I had done post-delivery? Can partners stay with mothers at all times following complicated birth, not just for visiting hours? What aftercare is there for parents who had a traumatic birth so that PTSD and postnatal depression can be avoided? How do we request copies of maternity medical records? These are examples of questions I'm not in a position to answer as I don't work for the Trust. For example, with medical records, requests to discuss care received, there are specific processes which need to be followed in order to arrange this. However, Louise Barnett, CEO at the Trust, has given assurances that if you have questions of this nature, they would like to help you as much as they can. And they've given the following email address for you to raise any questions: sath.maternitycare@nhs.net. Or you can call the Patient Advice and Liaison Service on 01952 641 222, extension 4382, and they will do their best to help you. We will ensure that this number and the email address is sent out to you in our written update. When can we expect the second part of the review to be published? I missed the date when the second report will be announced. My team continue with their work of reviewing the care and treatment that families received. We're aiming to publish our next report towards the end of this year. We do not yet have a date, but we will update you as soon as we know the arrangements for the next publication. Can we review our personal account with the person on the review team who spoke to us at first? Will all families receive a personal report on the outcome of their review or their individual case? We've not yet finalised the arrangements for feedback to families. We know that this will be after the publication of the next report, but we are still to make a decision how this will take place. Again, we will inform you once we know. What happens to the cases pre-2000? My team continues to review all cases referred to the review, including those before 2000. Can I have some information about the support groups? We have ensured that there is a range of support for families. If you email support@donnaockenden.com, one of the team will contact you and help you to arrange to speak to a member of the support team. Thank you for joining me today. I hope that you found the question and answer session helpful. My team will be in contact with you over the next week with information about giving your consent for the stakeholders, and I hope that you're able to join me for the next update in about 8 weeks' time. Details will be sent to you nearer the time. Thank you once again, and do contact us if we can be of any further help or support. Thanks.